Joining us now on the line, Tammy Martin, administrator of Cedars Health Center and the Greenhouse Homes at Traceway Retirement Community in Tupelo, and also Miss Renee Reid, director of public relations for Methodist Senior Services. Good afternoon, ladies. Thanks for joining us.
Thanks for having us.
George, thank you for having us on today.
You bet. All right, so I think one of the questions that's on a lot of folks' mind, we've been talking about here on the show, is just the staffing situation, the shortage of qualified personnel, particularly in the healthcare industry. It's a problem that is impacting the entire economy, the whole gamut of industries, but in particular, it's a concern when it affects healthcare because those of us that get sick rely on healthcare professionals to take care of us. So, Tammy, you first. What's that like in your world?
But I've asked Renee with our management company to join me, and she can give a broad overview across the state about what is happening.
Sure.
We have 12 retirement communities from Hernando, Mississippi to Biloxi, so I'm going to turn it over to Renee.
Great. Renee, please.
One of the things that we're seeing is, there's healthcare is a calling to begin with. A lot of people really have to have a passion to go into this field. So when they are, you get into a pandemic, it causes a lot of additional stress and strain on the staffing, simply because they are, there's a lot of extra that goes into taking care of a situation. There's all the extra PPE, the cleaning, the additional care, there's search, lots of additional people. You have the absence of volunteers that have always been there, who have made the workload lighter. And so when you get into that, there's a lot of stress and strain. At the beginning of the pandemic, we had a lot of people who kind of left the field because there was a lot of uncertainty. We didn't know what we were dealing with, and so they left because they needed to care for their family and their loved ones. But as we have moved through this, we've noticed that a lot of it has become the stress and strain of things that have worn people out. And so we're seeing a lot of people who are retiring early, who are going home to stay with families. And there's not a lot of additional people to come in to take those holes, to fill those spots. So what we're really focusing on right now in the area, in the healthcare field, is to make sure that we incentivize the right people to come work in the healthcare field, to make sure that we maintain and retain the qualified people that we do have, and that we care for them both mentally and physically so that they can take care of this load, and to make sure that people maintain their passion and their energy to stay in the healthcare field, whether nursing homes or in the hospitals or the clinics that are around the state.
There are several reports, certainly for me anecdotally, just within the medical community, that one of the things that's happening is nurses and other healthcare professionals are being attracted away out of state by healthcare institutions that are offering a dramatic increase in their pay and their compensation. Are you seeing that as well, or are you having to deal with that?
We are. There is a good bit of that going on, and it has required us to be extremely creative in the things that we've done, kind of thinking outside of the box. I can tell you from our experience some of the things that we've done to help maintain the staffing that we have. First of all, one of the first things that we did at the beginning of the pandemic is we created a hazard pay for our folks who might have to provide direct care to someone that had COVID, so that we recognized that they were stepping into a particularly unknown circumstance. And that the additional thing that we did was we provided a COVID pay, and not a lot of companies out there did this, but Methodist stood behind our employees and said, if you are asked to quarantine because of exposure, or a positive diagnosis, or if someone in your direct household is asked to quarantine because of positive or exposure, we're going to pay you for that time off, and you're not going to be asked to take PTO. You're not going to be asked to take your EIB. That's just something we're going to give you. Now, with the advent of the vaccines, we've adjusted that policy a little bit to allow people who have the vaccine to continue to be to have that reward. But that has been a huge thing for our employees to have that stress taken off of them. We've also included pay increases across the board for our frontline nursing home staff. We brought vaccination clinics directly to our facilities. We didn't ask them to go out and find other places to get it. We brought it to them to make it easy and accessible for them. And we also provided lots of reward cash for that. We offered $15,000 in cash prizes that we did some drawings, and 5 individuals won that cash. And then we have offered $50 bonuses to every single employee that's willing to get the vaccination. So we've tried to do some different things like that to make things better. The one thing that I would really say is we've gone out and specifically created some things that were meant to create a pipeline of employees in the future, not just for this immediate need, but consistently. We partnered with some education folks in the state, like Medical 2, to do some online CNA training classes. And then we held the clinicals at on our campuses. And we paid the tuition for the individuals who were willing to come work for us. And so that created our own pipeline of individuals to help fill these spots and to keep people from going elsewhere. Of course, our great benefits and that sort of thing. And if there's anything that I could stress more than anything is simply just being with your employees, knowing your employees, figuring out what they need and what their issues are. That's going to retain individuals and keep them from running to another place or to an out of state more than anything else. I think about back at the beginning of the pandemic when schools shut down, and none of us were prepared for that. And we had a lot of individuals who were saying, I'm going to have to quit my job because I have nowhere for my kids to go. We had some folks who reached out to find some childcare sources for our employees to help them find childcare for their children so that they could continue with their job. Funny anecdote is, when there was a run on the toilet paper, our employees were working so late and so hard they couldn't get to the store to get their own toilet paper. Well, one campus had a maintenance guy go down and buy several loads of toilet paper and brought it back and subdivided it for the employees. Those are little things that makes this that makes working in healthcare not just about a job, but about a family. It's more than work.
So are you guys considering a vaccine mandate?
At this particular moment, we are not requiring that, but we strongly support it. And we are asking our employees and our elders to be vaccinated. We have offered the clinics, as I stated, and we are doing a lot of education, a lot of one-on-one to help address people's concerns and their questions so that they can get the right information to make the decision that's right for them. So we strongly support the vaccinations and the safety protocols that are recommended by the Mississippi State Department of Health and the CDC. Right now, currently, across all of ours, not just nursing homes, but all of our retirement communities statewide, our elders are at about an 87% vaccination rate, and our employees are at about 52%. So that's
the residents are a lot higher. Residents are a lot higher than in terms of vaccination rate than the staff itself.
Yes.
Yeah, got it. I tell you what, I got a couple of more questions. Can you hang on through the break?
Sure.
All right, we'll take a break right here. We'll come back. We've got Tammy Martin and Renee Reid. They're talking to us about what's going on in the retirement communities, nursing homes, et cetera. Stay with us. We've got Renee Reid and Tammy Martin on the line. We're just talking about the situation in retirement communities, nursing homes, et cetera. So, Renee, what about the situation with this surge of cases due to the Delta variant? Are you seeing that have an impact on your various homes? How's that working out, and how are you dealing with that?
Well, yes. Obviously, the numbers are going up nationwide, and specifically in our state, we're seeing an increase because of the Delta variant. We have not seen the large surge in our particular nursing homes that we had seen earlier. With the Delta variant, it seems to be, as you well know, it seems to be targeting a little bit different audience than it did before. And so we are kind of pulling back, looking at where we are now, regrouping, making sure that we're doing all the things that we possibly can to safety measure-wise, masking, vaccinations, the entrance protocol for visitors, and that sort of thing. And following all the guidelines that the state and the federal government are giving us to make sure that we do everything that we possibly can to protect the elders and our team, but to also make sure that we continue to allow, engagement for elders so that family members can still come and visit.
Do you anticipate, I got to ask you this, we got some listeners curious, that once the vaccines are fully approved by the FDA, would you anticipate at that point you might mandate that for your staff?
That hasn't been elaborated on completely yet, but I could see that very much being something that we would do, because many other folks in the healthcare industry have already led that charge. I know that some of the hesitancy with employees and even our elders in getting the vaccine is about that specific approval. So I feel like once that's approved, you're going to see a lot of that hesitancy go away. And with that, I think not just with our industry, us, or with our industry, I think you'll see a lot of folks who do require those mandates.
Are you kind of in those circles? Are you hearing or discussing that with other healthcare providers and institutions or similar organizations to yours?
A lot more of the hospitals have already gone ahead and taken that step, more so than the nursing homes. But it is a hot topic right now, and many are right there at that verge of making those decisions. So, yeah.
So what about the this ICU shortage, that the stress on that? We're told now that there are no ICU beds available in the state of Mississippi. Does that present a particular problem for your organization in terms of the services that you provide and your residents, that maybe because of underlying health conditions and, of course, their age, are more likely to perhaps contract some illness where they need ICU?
Yeah, anytime there's a shortage of a care service, it should concern all of us. No matter what our age level or our need level is, it should concern all of us. Because as you see, the recommendation is that things that are unnecessary be postponed at this time. Or you see several hospitals who are saying, go to urgent care rather than come to the ER. So I think anytime that you have a surge on the hospitals or any care provider, it's going to cause stress and strain on all of us. And so we are doing everything that we possibly can to care for the elders within our charge as best as we can before we rely on or send someone out. But, of course, if they need that extended medical care that's beyond our expertise, we have to go to the hospitals and rely on them.
Yeah. And, there are some who say that with respect to the shortage of in particular, nurses, healthcare providers, but specifically nurses, that we should be able to just rapidly spin up some quick training, and there's folks out there that would be willing to submit to that, and they could just come right in and fill those shoes. What do you say to that?
Well, I mean, no, there's specific training that goes into doing this. There are things that can be done that would help. You can do, like I said, we partnered with the educators to provide training, online training for the CNAs, and then did the clinicals at our community. So there are things that can be done, but that is a specific training, and to shortcut the training that's necessary for the care is going to reduce the quality of care across the board. So if you can find ways, creative ways to address the needs that are not required by people who are specifically trained. If there's somebody that can come in and be a resident assistant, if there is somebody that can come in as a volunteer and handle things that would free up the tasks so that nurses could do those things, or CNAs could do those things, then that's going to help them out a lot. But you cannot just suddenly stick somebody into a nursing situation that hasn't been trained to handle that situation.
Yeah, and I saw that the governor has evidently got the federal government to agree to send some personnel in, healthcare professionals, to staff some of these additional facilities that are being built out. We see UMC, I guess, taking over floor of their parking lot, right, to spin up some beds and try to establish a makeshift hospital, if you will. And I think there's also something going on in Tupelo along those lines. And the governor announced, I believe yesterday, personnel are coming in. I'm just wondering where these personnel are coming from, because there's a shortage. Every state's dealing with this, essentially, how they were able to make that happen. But that seems like, I guess, a bit of good news in terms of just providing some relief for the stress on the healthcare system. But it's still a big concern.
Yes, absolutely. It's still a concern, but with those organizations being able to get those additional personnel on site to help them, it's going to alleviate the strain across our state, because we won't lose as many in the clinics and the smaller hospitals and the nursing homes. We won't lose as many employees to those larger hospitals that are a little more capable of providing those handsome sign-on bonuses and things of that nature. So it allows us to be able to maintain our staffing while they're still addressing this major surge that we're going through.
And we're certainly hearing of reports of nurses being wooed away into other states for additional pay. I've heard probably more reports from providers, as you indicated, however, though, Renee, that a lot of it's just folks are just burnt out. They're exhausted, and maybe taking early retirement, or just decided they're going to exit their profession and go do something else. I've heard that as well. But the question I'm getting to is, are you able to attract talent from outside the state into Mississippi and to come work for your organization?
Well, as I addressed earlier, we're doing some out of the box kind of things. We're trying to make sure that we incentivize folks that in recruitment to try and honestly, whether that's outside of the state, inside the state, we just want the kind of people who have a passion about caring for elders. So that's who we're looking for. And so we are doing the typical things that you do in job searches, but we're also adding some of those bonuses. We're adding some of those creative ideas to try to attract people to come work for us. And one of the biggest things is just trying to retain the folks that we have, so that they don't get tired, that they don't get burnt out, and that don't leave us to go somewhere else or to go home. Is to bring back, keep them coming back on a daily basis.
What sort of impact has the pandemic, and obviously if you're having to increase compensation, I mean, that's has a hit, on the overall expense model of the organization. We got just a second or two here, but what sort of impact's that having on your financial condition?
Well, we can't just change the rates.
That's what I'm
say,
thinking. Your
"Here's more
revenue doesn't
income
go up.
coming in."
Yeah.
Yeah, a regular place could just say, hey, for this product, I'm going to raise the price because it
Right.
costs more to get it here to sell it to you. That's not something that we can do.
Yeah.
So what we've had to do is make sure that we have been very diligent with what we've gotten. We've gotten several grants and relief funds, and those have
Gotcha.
been critical to
Gotcha.
cover those additional expenses like PPE and cleaning and additional staffing. So, anything that we can get in right now is critical to the ongoing operation.
Gotcha. We got to go, but I appreciate it. Very insightful. Thanks for coming on. We'll talk to you guys soon.
Okay, thank you.
We'll be
Thank
right
you,
back.
George, for having me.